MBL, and today I'm going to talk to you a little bit about how we monitor animal health here in the tank room. So there's some challenges when dealing with aquatic animals. So one of the challenges is just the environment they live in. So they're in an aquatic environment. Sometimes it can be really difficult for us to see them and to see if there's any potential lesions or issues going on with them. The other issue is that we have a lot of different species here. And what is normal for one species, like a smooth dogfish, for example, might be completely abnormal for, say, a chain cat shark. And so we have animal care techs here whose job it is to take care of these animals on a daily basis, and they become very good at picking up subtle changes. And so I rely very heavily on them to report to me when they see something that looks like there could be a problem. And so hopefully we can address it before it becomes more serious. So let's go ahead and take a look at some animals during feeding, and I can describe to you the different types of things that we're looking for.
Okay, so the first group of animals we're going to take a look at are skate. So these are, the common name is little skate. Leucoraja arenacea is the scientific name. And this is a really common species in our area. And so we keep quite a few of these animals mainly for embryo production. And so these animals are being fed a fish, a type of fish that we import specifically for food. And you can see we cut up big chunks and throw them in, and then we watch to see how they're responding. And so ideally the animals would be really quick to feed. You can see that they're going after the food. They seem very active, very interested. And then while they're feeding, we're watching for things like any obvious injuries they might have. Occasionally we'll see a bite mark, probably during mating. Sometimes they'll get some red tails, probably just from rubbing up against the tank. We do try to keep a bit of sand in there for them to try to minimize any rubbing damage that they might have. And you can see that all of these animals seem pretty active. There's a nice example of a male and female next to each other. The male is on the right. You can see the claspers there, and the female is on the left. So they're very easy to identify that way. And so we try to use that to create ideal sex ratios because, like I said, we use them for embryo production, and so we want them to be breeding. You can see this one's coming right up. They learn pretty quickly that the presence of humans usually means food. So there's just a real quick look at the bottom side. So in animals like these that are always just on the bottom of the tank, it's really important to occasionally flip them over so we can look to see if they have any lesions on their underbelly, because they do occasionally develop sores, and we need to tend to those very quickly because they can become infected and make the animal really sick. And so you'll see Dan's gonna get another one, try to get another one, and just gently flip them over, and we'll just take a quick look. Everything looks great. Try to keep them underwater. There we go. You can see the gills there. The mouth obviously is ventrally located. So these animals look great right now. And this is a close-up view of a skate embryo. You can see it on the left there moving around. That's the yolk, the big round dark spot in the middle. So this is how we just check them to make sure that they're viable and doing well. This is our little nursery tank for skates and chain cat sharks. So there's a little chain cat shark juvenile there, feeding him some mysids. We'll see if he goes for it, but he doesn't. So that's okay. We'll feed him a couple times a day and just make sure that he'll start feeding at some point. There's a little skate embryo right there, also known as mermaid's purses, and there's a juvenile skate, very well camouflaged there. They're not very interested in feeding right now, but they otherwise look like they're in pretty good body condition, so we're not overly concerned. So we'll just keep a close eye and check it, day to day. Once these animals get a little bit bigger and they're eating well and the water warms up a little bit, then we'll release them. So now we're going to take a look at some sharks. These are one of my favorite species that we have here at the MBL. These are smooth dogfish, or Mustellus canis. They're really neat animals. They are not a threat to humans whatsoever. Their mouths are really far ventral in their body. They have really blunt teeth, so they don't pose any sort of a threat. They don't bite. They're very docile. So we're just waiting to see if we can get some feeding behavior in here. And we just take a look at them. We look at their fins, the tips of the fins. Sometimes you'll see some redness. Sometimes we'll see parasites, in which case we'll often just sedate them, take the parasites off, do a skin scrape if we need to. It's pretty rare that we see injuries on these animals. They're pretty robust, but you can see they're feeding pretty readily, so that's a good sign. You'll see a behavior there. They get pretty agitated when we're around and when there's any kind of activity. So often they'll do this behavior where they come up and out of the water, and it's kind of contagious. The other animals will start to do it. There's Dan. He's one of our animal care techs here, so he's responsible for feeding and doing health checks on these animals every day. And he's got his PPE on. We're all taking precautions while we're at work. And we'll just let this video finish out here. So these are chain cat sharks. Ciliorhinus retifer is the scientific name. They are also sometimes known as chain dogfish, which is very confusing, but we call them chain cat sharks. So they're pretty easy to observe because they don't move around very much until they sense some food in the tank, as you'll see in just a moment. So we primarily keep these animals for embryos. We have people request them, researchers who are studying developmental biology. We also get a lot of requests from aquariums. These are a really popular animal for display because they're so beautiful. That looks like a pretty good sized female there. You can see kind of the swelling of her abdomen, so she's got some developing embryos there. These animals come from pretty deep water, but they acclimate really well in the tank room here. Their embryos are really cool. You can see through them, similar to the skate embryos, so you can watch them develop. It takes them quite a while to develop and hatch out, somewhere around 8 or 9 months, depending on the temperature of the water. So it's quite a long gestation for them. So you can see there's a little bit of movement. They're starting to sense that there's some fish in the water. They're pretty small sharks. They're not harmful to humans at all. There we go. There's a nice hungry female, looks like. They feed on squid and small bony fish. And they do really well for us. We rarely have issues. Occasionally we'll have some bite wounds from mating. Sharks and rays in general can have some mating wounds because they need to hold on while they're trying to mate. They do use internal fertilization. So sometimes as a result of that, we'll see some bites on the fins. Nothing too serious. We usually just monitor them or do some minor treatment, and they do really well. So these are really cool animals. Okay, so here's another good example of some fish that are very vigorous and readily seeking the food as soon as it's thrown in. So there's a spotted hake on the left there. There's a black sea bass right there, Centropristis striata. And you can see that hake has got a really great appetite, which is a good sign. There's another black sea bass that comes into view there. These are gorgeous animals. And so when we're doing the assessment, we're just watching to see that they're behaving appropriately. They're not having any kind of buoyancy problems. We can get pretty close up there. He's looking right at me, and I can look to see if I see any obvious lesions. Sometimes you can see parasites hanging off of them. Often we have to do a skin scrape to get a better idea if there are any parasites. And that's based more off of behavior. If we see flashing behavior, for example, we might do a skin scrape. There's a scup there, Stenatomus chrysops. They're really cute little fish too. So these animals are all really great eaters. They're really fun to feed, fun to watch. And this is another really good example of some fish that are in great health. We'll just let this play out for a minute. So this is what I mean by buoyancy problems. This is a black sea bass with an overinflated swim bladder. And we're able to sedate these animals and deflate it, and then they go back to normal and do quite well. This is a dogfish shark that has a lesion on the tip of its nose, probably from bumping into the side of the tank. In mild cases, we just treat it with a little bit of a topical skin glue, something that surgeons would use, and it just essentially protects the skin until it has time to heal. In more severe cases, we might put them on a course of antibiotics to prevent any kind of secondary bacterial infection. But again, they do quite well with just minimal treatment. So this is an example of an external parasite that we sometimes see in toadfish, Opsanis tau. These are lice. The genus is Argulis. And the way that we get rid of this is just manually removing them from the fish. So we have to put them under anesthesia, and then we just literally pick the lice off. We have to do this several times to get rid of the burden, but ultimately they do quite well with it. So we put them in an anesthetic bath to induce them, and then we take them out and we insert this water hose into their mouth that has the anesthetic in it, and it runs over the gills. And we're able to keep them under as long as we need to, and they do quite well with it. We're able to maintain a good sense of humor around here, and we're hopeful that these times will come again. But in the meantime, if anyone has any questions, please post them below. And thanks for watching.